Good afternoon. A very warm welcome to all our viewers. Today's Education on Air features a very highly respected individual. He received his veterinary degree from the University of Illinois and his MBA from the University of Redlands. After building his practice from a startup, he moved it, expanded it, and built it large enough to attract a corporate consolidator. After leaving private practice, he worked as medical director for veterinary pet insurance before becoming a full-time practice management consultant for both the practice and the industry. In addition to his role in practice, he is a past president of the Southern California Veterinary Medical Association and California Veterinary Medical Association, also Vet Partners, the national consultants group. In 2007, he was hired as the executive director of the Southern California Veterinary Medical Association, the largest regional veterinary association in the country. He has written and spoken nationally and internationally on various practice managements and leadership topics. It is my pleasure to introduce to you Dr. Peter Weinstein. If you have any questions for Dr. Weinstein, please press the Q&A bubble on the left side of your screen and type in your questions, and he will answer them at the end of his presentation. Hello, Dr. Weinstein. It is great to have you with us on EMD Education on Air. Would you like to tell us a little bit more about yourself and what you will be educating us with today?
Thank you so much. It's an honor to be a part of this program, this unique opportunity to educate people through Google Hangouts, which is kind of a new venue for me. The introduction that you gave is fairly inclusive. I do speak a lot on a variety of different topics, and I think the topic we're going to discuss today, staff meetings, is one that is, for many practices, quite a painful topic for the staff, a controversial topic for the ownership and management, and so I think we'll have a very good discussion today. Although I guess it's a one-sided discussion because with this webinar format I get to look at a screen and pretend that there's a whole group of people out there actually listening to what I have to say. So bear with me as I pretend that you're out there, and you can pretend that you're looking at me at the same time. So staff meetings, blank. There's a variety of different ways you can fill that in. But let's talk about it. It's interesting because in many practices, the way that the word gets around is the oldest employee tells the next hire, who tells the next hire. It's like the kids' game telephone, which is kind of shown here. And what happens is that the message that started out being accurate at the beginning is completely garbled by the time it gets to the last person in the practice. So having a formal communications program and a formal training and education program can help eliminate this garbling of communication that we frequently see in veterinary practices. The problem that we have with meetings is that people dread them. As an owner and as a manager, they're perceived to be expensive. They take up client contact time because instead of being able to see clients, you're having a meeting. And then, of course, unless they're kept under control, they turn into so-called bitch sessions. And then finally, the ownership walks out of the meeting and says, well, we didn't get anything done today. So as a leadership, you tend to dread meetings because you really feel that they have a negative impact on your practice. And then the other variables that come in is that who's got time? You know, business is too busy, we don't have time, you can't schedule them, staff won't come in on their days off, you know, there's no good time for everybody. And of course, when people are sitting there, nothing sticks. They're paying attention to everything else but what you're talking about. What's the return on investment? You know, I'm spending my time having this discussion, but what am I getting out of it? What is my staff getting out of it? And of course, you get this glazed look on most people's faces because you're either doing it early in the morning, you're doing it over lunchtime, or you're doing it at the end of the day when you have your meetings. And at any of those times, the staff's brains are not necessarily focused and functioned. And of course, unless the meetings are conducted correctly and unless the staff is getting some value from it, it's tough to get buy-in on the topics that are discussed. And then of course, staff meetings really need to have ownership commitment. The leadership at the top, the ownership, has to be committed to the fact that staff meetings have a value, make a difference, and will make your practice better in the long haul. And in my opinion, and in my practice, we believed in that. We believed that staff meetings were a significant contributor to the success of the practice. So ownership commitment is what determines which direction most of your staff meetings go. And of course, you know, some businesses just have the meetings for the sake of having a meeting, which kind of causes you to go crazy. It's a reason to get everybody together and everybody jumping down each other's throats. So you don't have a meeting for the sake of having a meeting. Let me repeat that. If you're having meetings for the sake of having meetings because everybody says you need to have a meeting, don't have a meeting. But on the other hand, if you have them, they can be very effective tools to get everybody rowing in the same direction. If you think about it, if you've got a practice, whether it's 3 people, 30 people, or 100 people, if not everybody has the same message and not everybody is singing from the same page of the hymnal, you have a cacophony of noise that contributes to the inefficiency and ineffectiveness of your practice. On the other hand, if everybody is rowing in the same direction, everybody's stroking on the right stroke count, then that ship moves forward efficiently, effectively, towards a finish line that is going to be successful for the practice. So here are some of the things we want to discuss today. What's a staff meeting? What isn't a staff meeting? Who should be there? When should they be conducted? Where should they be conducted? Why have them? Should you videotape them? What about, is there a need for an agenda? What's your optimal outcome? Should you be closed or not? Should you pay staff members to be there or not? Some of these are legal, and some of these are your practice. And then what do you do if you're a 24-hour facility? This is a great quote. The first person I saw this attributed to is John Wooden, the former UCLA basketball coach and leadership guru. Failing to plan is planning to fail. Really what staff meetings do is they allow you to plan for the success of your practice. And again, if we don't plan, we have no direction, we're just kind of going about our day, and all you're going to do is end up with failures because nobody is playing together in the same sandbox. You know, what we need to do, instead of being in a sandbox throwing sand at one another, is we need to be in a sandbox building sand castles together. So let's talk about the pre-meeting. Before you have your formal meeting, you really need to have a discussion as to what are the goals and objectives are going to be of the meeting. Remember, we talked about don't have a meeting for the sake of just having a meeting. So what do you want to accomplish in the meeting? And once you have that list of goals, then you have to sit down and figure out what's a realistic schedule. And that realistic schedule is twofold. It's a realistic schedule of when can you bring everybody together, and it's a realistic schedule or timeline to accomplish everything that you want to in the hour or hour and a half that you have scheduled for the meeting. So you've got an idea of where you want to go, you've got a time for schedule and a timeline, and then into that timeline we interject an agenda of topics. Do not, let me repeat, do not enter into a meeting without any focus, direction, or topics, because I can guarantee you it will digress quickly into little small group sessions of vomiting all over each other about the negative things that are going on. Instead of learning from your meeting, you will get burned by your meeting. Personally, I think food is a great incentive. It's somewhat of a distraction, but I believe it's an incentive to get people's attention and to get people to a meeting. Yes, you pay for the food. And then you collect the resources that are necessary to support the goals and objectives that you are going to be discussing at the meeting. And those resources can be articles, they could be videos, they could be audios, they could be scripts that you're going to practice as a result of role playing. They can be any of a variety of different things. But before you jump into a staff meeting, planning should go into it. And then, when it comes to the meeting itself, there are certain expectations. Attendance is mandatory. Yes, I know that there are some people who will not be scheduled that day that need to come in, but we understand that. If you rotate the day that the events are in, everybody should be inconvenienced at some point. Cell phones are off. No texting, no Facebook, no calls. Everybody should be directed and focused at the agenda of that day. And this is not an opportunity to just interject the fact that you're having a bad day. The subjects that will be discussed are relevant, and only those subjects that are relevant are on the agenda. I believe that staying on time shows respect for all parties involved, so I think somebody needs to be a timekeeper and somebody needs to be keeping an eye on the clock so that you can accomplish everything that you've set out to in the agenda and in the goals and expectations. So by doing this, you're letting your staff know, and your staff now knows that this is an important, stay-focused, educational forum for them as employees of the practice. So I like to think of staff meetings as kind of a rah-rah session, focus on the positive stuff, focus on all of the things that you're doing well, learn from the things that have gone well, take a look at some client compliments and comments that have come in that are positive. That the staff meeting is also an educational forum. Your team wants to learn. Your team really needs to learn, too, to be able to answer the plethora of questions that your clients have. So look at a staff meeting as an educational forum as well. And seek input from your staff as to what they want to learn. By asking them about specific topics, you can then build your staff meeting to teach them about hypothyroidism or Cushing's disease, why dentistry is so integral, what is the problem with obesity, why are we so worried about it, what are the different causes in lameness, what about some breed-specific issues. Ask your staff what topics they want to learn. Now, of course, if you have an integrated marketing plan, some of your educational components will be regarding what you do from a marketing standpoint. Your staff meeting is an excellent opportunity for public praising and celebration, recognizing an effective dental program, recognizing a staff member who has accomplished something such as a degree or certification. Anything that you can do to celebrate the accomplishments of everybody on the team, from the youngest animal caretaker to the oldest doctor. And a staff meeting is a great opportunity to talk about change and get everybody excited about it. And change can be as simple as new uniforms, or as more complicated as a new piece of equipment. It could be as exciting as new text messaging capabilities, or even an app for your practice. So use a staff meeting to get excited about the changes that might occur and will occur within your practice as well. Again, very positive, very focused on teaching, focused on change, and focused on moving the practice forward to accomplish the more global goals that your practice has. It's not an opportunity for the leadership to be banging on everybody. It's not a bitch and moan session. You don't serve wine, and you don't use it for public humiliation. Praise in public, punish in private. Praise in public, punish in private. Things that aren't going well as a group need to be addressed in some positive fashion. Identify what the issue may be and look for solutions. But you really should not be using a staff meeting to tell everybody, you know, we're down 20% this month, it's our worst month ever, and it's all your fault. You use your staff meeting to benefit people, not to beat up on people. It's not a reason for people to stay home sick. It's amazing how many people find that they're sick on staff meeting days, and definitely not a chance to pick on others. This is no one individual, no group is allowed to pick on anybody in this meeting. It's for positive enforcement, and if people start to digress and get into negativity and start to get into finger pointing, somebody's got to reel the meeting back in and get it refocused. Now let's just talk about the elephant in the room. Why don't staff meetings work? And it's because they're not structured, they're not organized, they're not fun. They're basically breakdown sessions for people to beat up on each other rather than what I'm advocating for, which is a build-up session. Stop it. Stop it right now. Do not use your staff meetings for negative stuff. If you are using your staff meetings for negative stuff, then you have a negative practice. Return to the concept of a positive staff meeting, very focused on everybody building up each other and building up the practice, and work off a structure, work off an agenda, keep it to task, keep it focused, and keep the griping out of the room. Love this sign. Every veterinary hospital could potentially have this sign. But let's think of it in a different fashion, because what we really want to do is have the morale to be positive all the time, because the staff is being supported all the time, educated, and motivated. So, why do we have staff meetings? What are the positives? They provide consistency and clarity. How the phone is answered, how clients are greeted, how money is taken. You know, if you're changing and using a different merchant services program, it needs to be discussed. If the leadership has made decisions, if there's some things that the leadership has come up with to change the way things are being done, then those need to be discussed at a staff meeting. They need to be troubleshot by the people at the staff meeting and looked at as a best way to accomplish the outcome of a decision that's made. And again, as noted, it's a great opportunity to celebrate the successes. Hey, we had our best month ever, we had our best day ever, we're doing great on our dental program, we're ahead of schedule. We're looking forward to going as a team to celebrate the following, whatever the case may be. Now, obviously, no practice is perfect. So one of the things that you can do is you can use a staff meeting to acknowledge and recognize general mistakes, but you want to do so without any specific finger pointing. You want to look at the problems that occurred in a general fashion and identify solutions to change the system so that they don't occur again in the future. Individual issues are dealt with one-on-one in private. Overall systemic issues, things that need to be changed, can be dealt en masse at a staff meeting. Staff meetings are great for so-called lunch and learns on new products, new services, or new procedures. I mean, if you're adding an ultrasound unit, what is an ultrasound? How does it work? When are you going to use it? If you're adding digital dental x-ray, same thing. New products, new services, new procedures, new tools, all of these things become great teaching methodologies to deliver at a staff meeting. Of course, there's always the leftover housekeeping items, and I don't mean physically housekeeping in terms of lint, dust, and smell. I'm thinking more in terms of just small items that need to be addressed from a prior staff meeting. You'll have the opportunity to carry things over from meeting to meeting if you have a formal format where you're bringing things together. And there is no one individual who is allowed to dominate a staff meeting. In fact, we would encourage each department head and or each individual, depending upon the size of your staff, to give a report on the projects that they're working on and how things are going. Bottom line is, if owners and doctors are talking too much, not enough has been delegated. Staff meetings should really be run by the staff. The managers and owners are really there to help facilitate the discussion, because the staff meeting is all about the team, not about any one individual, but it's about the outcome and the delivery of the services and the products by the team, and the team is the one who really should be identifying problems, identifying the things that need to be fixed, as well as looking for solutions to fix them, as well as educating each other. So do it right. Look at it from a different fashion. Don't use it as a way to beat up your staff. Use it as a way to bring up your staff. So the why, who, when, what, where, how, all the different questions that come up about staff meetings. Why? Because it's a great opportunity to educate and update. It's a great opportunity to review the way things are going, what can be improved, can we change the way we're doing something, and most importantly, it's a great way to get everybody in the team on the same page of the program. I can't tell you how many practices I've been in where the right hand doesn't know what the left hand is doing, the reception staff doesn't know what the technical staff is doing, the technical staff doesn't know what the reception staff is doing, and the doctors don't have a clue what anybody's doing. Everybody needs to be on the same page of the program to deliver that outstanding client experience that your clients want and that they're paying for. So the why is all on the very positive side of things. It's to improve the way you're currently delivering veterinary care and service. And it's not so people can sleep. Who is everybody. If you're not consistent, you're non-existent. Everybody needs to be on the same page. It's all the staff. Doctors need to be there. Managers need to be there. You can bring in some guest vendors to do your lunch and learn. You might even bring in the accountants, the bookkeepers, and financial planners. You can bring in whomever you want. The goal here is the following, is to get everybody on the same page. Now, what's the message to the staff when the owner and doctors aren't at a staff meeting? To me, it's that they don't care or they're above it. So I need to reiterate the fact that the doctors, young and old, need to be there. Now, they may be there as a advisor, they may be there providing information, but doctors and owners need to be there to give a message that says, this is important to me, I am here, I need you here as well. When staff meetings, some practices do them daily. They call them rounds, they call them huddles, whatever you want. Some people do them weekly, every other week, twice a month, monthly, and then of course there are those who don't do them hardly at all. When can you do them during the day? Some people do them at lunch, some people do them in mid-morning, before work, after work, weekends, whenever works from a consensus standpoint. Get the vast majority consensus of when is the best time to do it, and schedule it, and be routine about when you're scheduling it. Our staff meetings were every other Thursday from 12:30 to 2, and we had to sign up for our clients to let them know that. We lock the front door, turn the phone lines over. We'll talk about some of those things as we go on. And then, of course, the once-in-a-blue-moon approach to staff meetings doesn't work. It's I've done this presentation in front of large groups, and I would suggest that fully 10% of the practices have meetings every 2 weeks or more frequently. Another 20% have them once a month. About 30% have them once a quarter. And the vast majority, 50% or so, based upon my numbers that may not add up, but about 50% or so can't even remember the last time they had a staff meeting. Where do you have them? Depends on your physical plan. Depends on where you can get everybody to fit. We used to rotate between the reception area and the treatment area. You could look at affordable alternatives, such as bank buildings who might have a conference room, or restaurants that might have a private room from that standpoint. However you want to do it, you want someplace that's kind of free of distractions. The treatment area always seemed to have distractions with animals in cages. The front reception area had distractions because of people walking in or knocking at the window. Sometimes going off-site is the most effective and efficient way of having a staff meeting. Here's my opinion on how. Close the doors, turn over the phones. What we used to do is call forward the calls to one person's cell phone who would answer the phone and see if it was necessary, or we had a recording that said we'll be closed from 12:30 to 2 for a staff meeting if you have an emergency, and we gave an alternative from an emergency standpoint. Avoid interruptions. It's interesting how during a staff meeting, everybody is running to the front desk area to greet a client. But during the day, nobody's in a rush to greet the same client. So by taking interruptions out, by locking the front door, by not having the phones to answer, it keeps the focus for that 60 to 90 minutes that you're going to have to meet. I would never go longer than 90 minutes. Both your butt and your brain go numb within that time frame. 60 minutes, maybe 75 works best. Definitely have some food there. No question you have an agenda. Somebody should be taking minutes and making sure that everything is annotated and any action items that come out are highlighted. And those minutes should be distributed after the meeting to all those in attendance. And then here's a question. What about videotaping your staff meetings? I think they're great. You create a learning library for new hires. Remember, staff meetings are being used to teach as well. New hires now have a learning library on whatever topic you covered. Additionally, for those people who aren't there, your videotape becomes a way for them to catch up by watching the staff meeting. And I can guarantee you that once they have to sit through 60, 75, or 90 minutes of a staff meeting, they'll find a way to be there because there's probably nothing more boring. But I do think that archiving your staff meetings in conjunction with minutes is a great way to build a teaching pool of information for new hires or existing hires who need a review. I love role-playing. Staff members hate it. One of the greatest things I did at a staff meeting one time is I made the doctor at the staff meeting be a technician and be the exam room nurse and show the rest of the staff how they wanted their pets checked in, which was nowhere close to where they were being checked in because I never talked to the exam room nurses about how they wanted them checked in. Staff meetings are a great opportunity to develop and rehearse scripts for telephone services, for marketing programs that you might have. Integrate script development and rehearsal to every staff meeting, because every staff meeting is going to have something in there that will be associated with the telephone. And you could even do some problem solving. You know, Mrs. Jones walks in with the following, Mr. Smith calls with the following, or what do you do when a hit-by-car cat comes in, the client is carrying it, and it's not moving, or it's cyanotic, or whatever the case may be. What are the action items? What your ultimate goal is to start to standardize the way things occur and to make them flow without having to think about it. So if Mrs. Jones walks in with a blocked tom, what are you going to do? Mrs. Smith calls and asks about her dog that's been vomiting for 3 days. What are you going to say? How do you avoid being boring is you do some hands-on type stuff. What we used to do is at one staff meeting a year or so, we would bring up all of the animals that were in the hospital for whatever they may be in for that were not critical. And everybody on the staff would do a dental grading, and then we would discuss the teeth. Same thing with body condition scoring. Whether you're doing 0 to 5 or 0 to 9, you could grade all the pets in the hospital and discuss them. You want to have some fun at a staff meeting? Talk about firing a client. One of the greatest Christmas holiday presents that a practice can give their staff is the ability to choose a client of the year to get rid of. And then, of course, I've had practice board staff meetings where they've had some fun, and the way to avoid the boredom was that staff members were allowed to imitate clients, mock them, so to speak. You want to have it be avoid the boredom? Have the doctors role play being receptionists. You'll get a laugh out of that one. And then, of course, there's plenty of team building games that you can find online or at bookstores. We still have bookstores, don't we? That can be used for team building purposes as well. And yes, it's okay to have rewards, gift cards, or whatever the case may be for the funniest client imitation or for team building games and things of that nature. So make them interactive, force your staff meetings to be interactive, force your staff meetings to be educational, and tie the two of them together. So here's a sample agenda for an hour-and-a-half staff meeting, which isn't really an hour and a half. 12:30, everybody gathers, grabs their food, and starts to settle in. 12:45, the manager or owner-manager, depending upon how things are set, gets everybody settled, and they go through the agenda. So here's what we're going to cover today. And then you can take a couple of minutes to have some fun Trivia question. Right now, if you're watching it at the same time that I'm presenting it, the World Cup could be a discussion, for example. Talk about some small leftover housekeeping issues that were on the last agenda, and then about 10 minutes in, you can start to focus on a clinical topic. So I would suggest that the clinical topics could be provided by a technician, they could be provided by a young associate, they could be provided by an owner, or they could be provided by a manufacturer who's coming in with a skin shampoo or a dental specialist or whatever you want to do from a clinical topic standpoint. And give yourself a good 15 minutes on that, ending it up with a Q&A. And there should be good questions that come out of the Q&A, and guess what? Many of those same questions are the same questions that your clients are going to ask. Good questions, good answers get documented in the minutes because they should be kept in an archive for future Q&As that might come in when a client should call about these issues. So please, part of your videotape could be transcribed into a Q&A book on questions that come up as a result of dental disease or obesity or skin allergies or whatever the case may be. So after your 15-20 minutes or so on the clinical topic, then you could put in 15 minutes or so on a service topic, closing phone shoppers, dealing with angry clients, taking money in the exam room versus the front desk. And again, follow that up with a Q&A on the same issue. And then take 10 or 15 minutes to talk about the marketing program. What's going on from a marketing standpoint? Now, as a sidebar, you could do an entire meeting just on your marketing plan. So if you are in the middle or about, if you are about to launch into a large marketing plan, then integrate that discussion into a longer portion of your staff meeting. But if you're having a staff meeting and you're already engaged in a marketing campaign, then use it to discuss how the campaign is going, some of the issues that are going on, and maybe to add some new information that staff members can use when they're talking to clients about it. Then you kind of move into a wrap-up phase of accolades and final comments, clean up and back to work by 2 o'clock. So you always want to make sure that you have somebody who's going to keep the minutes and somebody who makes sure the videotape is done. And if you create this system, if you create a template and you fill this in, you now have an agenda for virtually every staff meeting that you're doing, and you can combine some topics. Your clinical topic may also be your management topic, and it may also be your client service topic, depending on how you integrate things into your staff meeting. Write it down, stay to task, stay on agenda, keep some minutes, videotape the meeting. Where do you find your topics? As I noted earlier, ask your staff. I've seen some practices, using team teaching. One of the most fun staff meetings I attended was team teaching between a licensed technician and a receptionist on blood smears, where the technician focused on the technique for blood smears that was optimal, and the receptionist, client service person, talked about the importance of blood smears and what you learned from them. It was really quite cool for a receptionist who was not that well integrated into the back of the hospital to talk about something, and they had a much greater understanding of what a CBC was, what a blood smear interpretation was, so when clients came in or asked about it on their invoice, they could explain them. And then, of course, your marketing plan is integrated into your staff meeting discussions as well. If you have a 12-month marketing plan, what you're going to do is you're going to have 12 months of different staff meeting topics that you can use to help educate your staff and to have them be a part of the whole marketing team, which is a necessity for success. Grading teeth, easy one. We talked about that. How to interpret a blood smear. That was the one I was just talking about. And then, of course, the public acknowledgments. We did an Employee of the Month that was voted on by the employees. We also had a accolades bowl, or whatever you want to call it, where Each staff member could put a small note in there that somebody did something to help them out. We had a pet of the month, so the staff would discuss and select a pet of the month based upon a variety of different variables, usually pain and suffering. You could have a client of the month, a client of the year, who's the best client, who's the worst client. All of these different things could tie into part of the program as well. But did you see anything in this agenda, and did you see anything in this discussion that gave you room to focus on negativity? The answer is no, and I can't emphasize enough that staff meetings should not be used to denigrate the staff, to belittle the staff, to tell them how inept they are. They get that enough on a day-to-day basis, hour-by-hour basis. They don't need to get it done in a public forum. Praise in public, coach in private. Praise in public, coach in private. So why do we videotape it? Well, you could use it as a punishment for no-shows. To me, you videotape it because it creates a learning library. You can videotape it because it helps with accountability. And we used to actually have quizzes that were based upon information from the staff meeting that were written and had to be turned in. Videotape allows you to have a training program for new hires. Why? Because what you cover in a staff meeting in August may not get to the ears of a new hire in January unless the training is consistent. Remember, training needs to be consistent and repetitive and predictable to give a client experience that makes the client happy and the pet healthy. So what happens during a staff meeting that drives people nuts? Going off on a tangent. Talking about things that aren't on the agenda. Talking about things that don't have anything to do with anything under the sun, but somebody likes to hear themselves talk. And then, of course, we sometimes get into irrelevant debate. And when I see this most frequently, it's between a receptionist and a technician, a doctor and a staff member, rarely between two doctors. Sometimes the manager gets involved. But this concept of irrelevant debate, all that does is contribute to a negativity. And, of course, that nitpicking that goes on and just picking on people for little things that they did that has nothing to do with anything more than isolating an individual for the things that they've done. And then, of course, as I mentioned and I've repeated repetitively, is that criticism doesn't do anybody any good in a public forum. I'm not going all Pollyanna-ish on you. I'm just suggesting that use the public forum to build up. Use the public forum to educate. If there are issues, address them one-on-one or small group. Really, somebody else's problem in one area of the hospital, if it's a global problem, need to be addressed in a more service-based discussion rather than, well, you know, the receptionist can't handle this, so we're going to push it onto the techs. And it's the receptionists then sound negative because they're quote-unquote can't handle it. Don't make your staff meetings negative. Did I say that enough? So, we're moving along pretty quickly here, which will give us more time for questions or more time for you guys to go have a staff meeting. But in summary, no leader, no documentation, such as an agenda or minutes, and no follow-up from the meeting in terms of ensuring people learned, you have a wasted time. It's a waste of 60 to 75 to 90 minutes. There has to be leadership. The leadership is sending a message. All of this needs to be documented and is part of your training systems. And there has to be follow-up to see what was retained, attained, obtained, see if it's maintained. Again, you need a leader there who believes that meetings are important. If a owner does not show up at a staff meeting, there is a message there that says, well, can't be that important, the owner. There has to be a stated purpose. Why are you having a meeting? Don't have a meeting for the sake of having a meeting. Have a purpose. You need to have a very specific start time and a very specific end time and adhere to it. Don't run late. Don't start late. Yes, there are things that could impact that, but if you can be at the 90th percentile for start time and end time, I would be happy. And then give everybody a reason to be there. The educational component, maybe they can win something, but give people a reason to be there. If anybody's going to show up to get beaten, they'd be crazy. So really, if they're going up to be praised, showing up to be praised, that's great. You know, they want to show up so they can get a pat on the back. They want to learn, they want to contribute to the practice, and they want to be heard. So make the agenda, make the topics, make the discussions attractive enough for everybody to be there. Make sure that you've got clear ground rules. Ground rules basically, as I noted earlier, maybe no cell phones and other things. Use what I call a parking lot for those issues that don't get addressed or need to be put into an agenda for next time or future discussion. These are maybe some of your housekeeping items, but I'd create what we call a parking lot to put these into. If you have a whiteboard system, and you can use a digital whiteboard or a red whiteboard, ideas can go on the whiteboard. There's no such thing as a bad idea. The ultimate goal is really to get everybody on the same page of the program. Get everybody to agree to a protocol, a procedure, a system, whatever the case may be. And if it differentiates from what you believe, try to figure out the positive in it and accept it so that you can help move the goal forward. The ultimate goal is to get everybody on the same page, which gives the optimal experience for that client. In my opinion as well, the best time to have a staff meeting is in the afternoon. I'm tired, the staff is tired, they're all hungry, but it's much harder to pull these things together in the morning. Staff get most of their work done in the morning and seem to be a little relaxed after lunch, so you might even do a 2 to 4 type meeting. You can do 12:30 to 2, however you want to schedule it. And don't forget that in between the more global staff meetings, if you have department meetings, management meetings, or doctor meetings, you can actually sometimes shrink your agenda. And what a department meeting can do, you could have a receptionist meeting where you invite the head technician to be there, and vice versa. Management meetings might include a head tech, head receptionist, head animal care, doctors, and managers. And doctors' meetings may or may not include the managers when it comes down to it. So you can use smaller group meetings to address issues prior to a larger staff meeting, with the ultimate goal of keeping your staff meeting agenda down to bare minimum as well. So let's see, how did we do? Did we talk about what a staff meeting is? I think we did. We also talked about what it's not. Again, staff meeting is an opportunity to educate and build up. A staff meeting is not an opportunity to break down and bury. Who should be there? Everybody. If they're not there live, they should be watching the videotape, and there should be a quiz associated with the videotape that forces them to watch it through, because the question can only be answered if they watch the entire thing. When should they be conducted? I would suggest at the minimum twice a month, and an optimal period once a week. Shorter meetings once a week may be more effective than longer meetings every 2 weeks. Where should they be conducted? In an area that's not distractible. I don't know if that's a word or not, but reception area, kennel area, do have their distractions. If you need to use a private room in a restaurant, great. Private room in a bank, great. Whatever the case may be. But conduct them somewhere where you minimize distractions, turn the phone lines over, put notes up everywhere, let people know that you're having a staff meeting for the benefit of the patients. Why do you have them? Well, you're doing them to educate, improve, and create consistency. The optimal outcome? Better trained staff. A better trained staff has higher longevity, greater engagement, more commitment, a feeling of contributing to the success of the practice. A untrained staff is constantly being berated, constantly being questioned, constantly unable to deliver on the level of care that's being expected, and it's all because nobody took the time to teach them how things are done at your practice. Don't forget to videotape your staff meetings to create your learning library. Videotaping comes only after you have your agenda. Role-playing should be a part of it because I do believe role-playing helps you learn. Don't forget somebody needs to take minutes. When it comes down to whether you're closed or open, if you're 24/7, it's hard to close. But if you're not, and your clients have been well advised and prepared, and pickups and other things are advised from that standpoint, then a sign on the door that says, "We will be closed every other Thursday for a staff educational forum. Please make arrangements to pick up your pet before 12 or after 2, or your prescriptions or food or whatever the case may be, to avoid having to interrupt our educational program." So I think that your practice should be closed. I think your voicemail or mail should roll over to a message that says we're in the middle of staff training. If this is an emergency, ... decide how you want to handle it. Definitely should be paid. If somebody comes in on their day off, they definitely should be paid. There's no question that if you're making it of value to them by paying them, they will more likely think highly of you, and it gives a message to your staff that it's important enough to you to pay people to be there. Commonly asked question: what about 24-hour facilities? What do you do with those? Well, you may have to do 2 meetings or 3 meetings to cover different shifts, but that's where videotaping can come in, and I think doing 2 or 3 meetings is not unheard of to try to cover all of the different shifts, but you can have leaders from a morning shift in there in the afternoon and vice versa to ensure that there's a consistent message that's happening all of the time. So, finding the right balance between doing the work and communicating with each other will achieve wonderful results. In my opinion, one of the greatest shortfalls in the average veterinary practice is a lack of communication. To me, a staff meeting is a great opportunity for people to break down some barriers and enhance the communication between people to achieve the ultimate outcome for the client and the patient, the staff members, and the practice. At this point in time, I will turn things back over to our esteemed facilitator and see if there are any questions.
Yes, thank you, Dr. Weinstein. That was very educational indeed, and there are a few questions for you. So let me give you the first question. And it goes like, Dr. Weinstein, what are some of the top requirements or reasons for meeting in a veterinary practice? What should be the main purpose, goals be behind the meetings?
To me, the main purpose is education. Basically, to teach your staff more so they can be of greater value to the practice and greater value to themselves as a member of the practice team. So I would say that the primary purpose is education, and I would say a second primary purpose, if you can have second primary purposes, would be to have a consistent message so that everybody is saying the same thing. It doesn't have to be said the same way, although that's not a bad thing, but it should be the same thing so that you're giving a consistent answer to your clients, a consistent message. So education and bringing the team together to all be on the same page of the program, and so that the team feels that they are contributing to the success of the business. I'm a huge advocate for team-based healthcare, and to me, the only way to have team-based healthcare is to bring the team together and have these types of discussions. And if I may interject for just a second, this slide has my email address on there. If anybody would like a copy of the slide set, please feel free to send me an email and I will send them to you.
Great. We'll go on with the second question. Can you elaborate on the biggest differences between the two, staff meetings and staff training? I believe some people use the terms interchangeably, and that is not correct.
Okay, there are two different things, and you can integrate staff training into a staff meeting, or you can have two separate get-togethers. A staff training to me is usually focused on a specific area that you want to train in. Let's look at dental disease. Let's look at cleaning teeth. You may train technicians on dental x-rays. You're really trying to focus on a specific niche area that you want to work on from a training standpoint. From a client service standpoint, that may be answering the phone. Now, you could have separate staff training based upon areas within the practice, or you can have group staff training that goes through a staff meeting. And what a staff meeting to me is bringing people together for the common good, with education as a part of it, a discussion as a part of it, cheerleading as a part of it, and training may be a part of it as well. So I think staff training can be a standalone. I think staff training could be integrated into staff meetings. And I think staff meetings could be a standalone as well if you have, again, a specific agenda and there isn't a need to have some isolated training as a component of it. But I do believe education is the foundation for both a training session and a staff meeting.
Okay, we have a third question. What are some of the ways that a veterinarian can make the staff meeting an effective tool in managing and building the team?
Great question. How to make it an effective tool is to, at each staff meeting, have a different staff member be the facilitator. What you're doing there is giving people the ability to grow and become leaders. I think what happens too often in a staff meeting is the doctor, owner, or manager are too much of a dominant fixture, and it forces the staff to almost shut up. But by having other staff members facilitate the meeting, you're giving them some leadership capabilities. You're taking people a little bit outside of their comfort zone, but you're giving people an opportunity to feel more comfortable in terms of discussion. I'm not saying that the owner and the manager shouldn't be at the meeting. I'm just suggesting that a staff meeting should be used as a team building opportunity, and the best way to do that is to integrate the entire team into the meeting itself. A top-down meeting is not nearly as effective as a bottom-up driven meeting. So I like the staff members to contribute to the agenda. In fact, we had a whiteboard in the staff lounge where they could write down areas of things that they wanted to talk about. I really do think that the staff meeting, if it's used to build people up and everybody is supportive of one another, can break down some of the communication barriers and issues that happen to occur as a result of most veterinary practices having kind of this little silo area of you've got your reception silo, your technician silo, your animal care silo, and nobody wants to go from silo to silo. But staff meetings allow for a discussion of things and hopefully allow for problem solving when they occur to enhance communication from silo to silo, although I hate that term, but let's just say from the client service area to the animal care area to the technician area. So staff meetings through use of different leadership styles, through team building exercises, and through rewarding the outcomes and even just the efforts can become a great management tool and leadership and training tool as well.
Okay, we have 3 more questions and we'll go on with the 4th.
Mm-hmm.
What are some of the ways that one can make practice staff meetings fun but not go overboard or eat into a lot of time? Do you have 3 top suggestions?
3 top suggestions for fun at a staff meeting. Number 1, food is always making it fun. Cake or party stuff. You know, we've played games. There's one of these balls that you wind up, and it's got a timer on it, and you pass it around the room, and then when the timer goes off, the person who's got it has to say something nice about somebody else in the room, or throw up a topic for discussion, or whatever the case may be. We used to blow up rubber gloves and bounce them around during staff meetings, and every once in a while we got a little bit rambunctious and grabbed some 60cc syringe and had some water fights, or used the dental unit. Sometimes you just have to interject fun into it, and you know what? Staff meetings for fun can just be a lunch with an agenda that basically says today's staff meeting is just for everybody to get to know one another. So 3 biggest fun ways to do a staff meeting: fire a client, imitate a client, have it off-site, someplace where you can have fun, and I would actually have consider having a staff meeting at some sort of venue like Dave & Buster's, where you could have a little bit of some competitions going on as well too. Quizzes, rewards, accolades, all of those things can make a difference.
Okay, that's a staff meeting I would like to go to. Let's go with the 5th question. In terms of keeping the staff meeting consistent, it is important that the designated people for minutes, videos, leading, follow-up, etc. stay the same. Or can these responsibilities and roles rotate? What is your idea or recommendation?
I think they should rotate. Sorry to interrupt. I think they should rotate. I do think that letting everybody be involved with the different parts of the meeting and building the agenda. Obviously, as I think I mentioned just a little while ago, having different people facilitate the meeting allows different people to meet to fill out the agenda. And so I think the agenda template should be fairly stable, but I think the topics that go in there and how the meeting is facilitated can easily rotate. I also think that people will hide behind a role such as taking minutes or videotape and say, well, I'm too busy to do that to pay attention at the meeting. So one way to make sure that everybody is engaged at all times is to rotate responsibilities so everybody is involved. Remember, veterinary hospital is a team, veterinary medicine, the delivery of veterinary health care. The delivery of veterinary health care is a team sport. This is not track and field. This is not swimming. This is football. This is baseball. This is basketball, where you need to pass the ball around and get everybody involved to be ultimately successful. A team sport where one individual is dominant rarely leads to success for the team. So let me repeat that. You would not go out for the Super Bowl with a team that has not prepared and hasn't got the playbook that everybody is reading from. Think about that and put it together in your practice so everybody is on the same page and all of the team is working together to accomplish the final outcome.
Okay, we'll move on to the final question. Please speak to us a little on staff training. When, why, how often, and what are some of the major non-clinical subjects that need to be covered in staff training sessions?
Great question. Staff training, non-clinical, client service, body language, answering the phone, tone of voice, telephone scripts, presenting a healthcare plan, also known as an estimate, talking to clients about money, dealing with difficult clients, enhancing client compliance through education. All of these are potential areas for non-clinical discussions. The frequency, I would think you could have a short staff training every week on a specific, very narrow, very focused topic. You may have a client service area training, you may have a technician team training, you might have an animal care training. I would suggest that weekly or every other week training on a very narrow, very specific topic where people can learn from it. I think sometimes going too broad-based is delusional in the sense that you can't get enough done. So work on some very specific topics, and again, ask for areas that could be used for these topics because I think the staff has some of them as well. Most of the topics that are not clinical in nature will either be on client service level, or I would even say animal handling level, safety. There is no question that safety in terms of OSHA is a huge area for ongoing staff training. And when I mean ongoing, every staff meeting, every other week, should have some small safety discussion, whether it's keeping floors dry, not climbing up on cabinets, the way people lift, etc., etc. I could go on and on about different topics, but everything in your practice has an area for improvement, and that's where you just bring it up as a topic. You know, things that have occurred, how can we improve on the way we do it? Greeting clients, bringing food out to the car, answering the phones, calling clients with follow-up lab work. I mean, do you want me to go on? Because I could. But I think the bottom line is in frequency, small meetings frequently by department, larger meetings once or twice a month by group on a training, and again, those can be integrated into your staff meetings. And look at the areas that are working well. How can you improve them? Look at the areas that you're having problems with. How can you fix them?
Okay, thank you, Dr. Weinstein. That was very educational, and thank you very much for your time and being with us and spending this hour with us and educating us on staff meetings. Unfortunately, our education on air comes to an end, and until we see you again, it's goodbye and a very good day to all of you.
Thank you, and feel free again to ask for the slide set.
Goodbye.